Welcome to another episode from the Veterinary Medicine Digest. Today, we're diving into a crucial topic in veterinary surgery, the diagnosis of ectopic ureters in dogs, a common cause of urinary incontinence in our younger canine companions. Our discussion will focus on the accuracy of advanced imaging compared to traditional methods.
That's right. Ectopic ureters are classified as intramural, opening within the urethra or vagina, or extramural, emptying directly into the distal urinary tract. This distinction is critical because intramural cases are treatable with cystoscopic laser ablation, while extramural cases risk perforation if that method is mistakenly applied. Accurate preoperative diagnosis is vital. While computed tomographic excretory urography offers detailed, multi-plane views, it has limitations in distinguishing types and pinpointing the exact opening. A recent study, therefore, compared its findings with cystoscopy, hypothesizing its accuracy might be less than anticipated.
And the results from this study, involving 35 dogs, certainly highlighted those limitations. When assessing individual ureters, computed tomography correctly identified a normal ureter only half the time. However, it was quite good at identifying a truly ectopic ureter, correctly 91% of the time. The real challenge was predicting the precise location of the urethral opening, especially near the urethral sphincter area, where sensitivity plummeted to as low as 0 to 15%. Even simplifying these locations into broad, ectopic, or non-ectopic, groups, accuracy was only moderate, around 81%. For surgical planning, a significant 26% of cases showed discrepancies between the computed tomography prediction and surgical findings, sometimes altering the entire treatment approach. Interestingly, factors like body condition or age didn't seem to influence these inaccuracies.
Those findings are indeed important for surgeons. The study revealed that computed tomographic excretory urography showed variable accuracy, with particularly poor sensitivity for extramural ectopia. This means if computed tomography falsely suggests an intramural ureter when it's actually extramural, there's a serious risk of urethral perforation if cystoscopic laser ablation is attempted. It was more common for intramural ureters to be mistakenly identified as extramural. Anatomical complexity, contrast agent behavior, and the ureter's natural curves all contribute to these diagnostic challenges, especially near the bladder sphincter. The key takeaway is that while computed tomography is valuable, it cannot be the sole basis for diagnosing ectopic ureters or planning surgery.
So, the clear message is that to maximize the chances of accurately identifying urethral anatomy and to make the best clinical decisions, surgeons should ideally utilize both cystoscopy and computed tomographic excretory urography. It's a bit like navigating a complex landscape. You wouldn't rely on just one map, especially if some areas are prone to misrepresentation. Combining different perspectives gives you the clearest, most reliable path forward. Thank you for listening to the Veterinary Medicine Digest. The title for the reference paper is in the video description. Remember to test your knowledge by answering the questions below, and as always, keep those minds inspired, hearts light, and tails wagging.